Hey everyone, today we are going to discuss about the topic Posology, specifically pediatric dose calculations. The term pediatrics in general refers to branch of medicine dealing with children and their diseases. About 23 to 51% of global population constitute pediatrics. Around 30% of the prescriptions received in a clinical pharmacy constitute pediatric population-related doses. And according to FDA, the term pediatrics refers to different subpopulations, namely preterm or premature indicating less than 36-week fetus, gestational term indicating greater than 36-week fetus, neonates indicating 1 month babies, infant indicating 1 month to 2 years babies, child indicating 2 to 11 years babies, adolescent indicating 12 to 18 years. Now we'll discuss why pediatrics require a special dose modification. Children are not just little adults. Children's pharmacokinetic parameters like absorption, distribution, metabolism, excretion are very unstable. They change during maturation from neonates to adolescents. Notably, pediatrics ADME parameters are significantly different compared to adults. Coming to absorption, the gastric emptying time and intestinal motility is low in children. Hence, there is a prolonged transit time which is observed, resulting in slow absorption compared to adults. In preterm neonates, the thickness of stratum corneum is very thin, resulting in increased absorption. Coming to distribution, the total body water content decreases with increase in age. Hence, large volume of distribution is observed, resulting in less dose sufficiency for children. The fat store increases with increasing age. The plasma protein binding is observed to be very low in infants. The enzymes corresponding to phase 1 and phase 2 reactions of metabolism are very less, resulting in less metabolism in children compared to adults. Elimination is also observed to be decreased in children compared to adults. Hence, dose modification is essential for pediatrics, necessitating assurance of potency and safety. Now we will see how dose adjustments can be done for pediatrics. Dose adjustment in pediatrics can be done in 3 ways. Number 1, based on age. Number 2, based on body weight. Number 3, based on body surface area. Based on age, different formula like Young's formula, Freed's formula, Delling's rule, Cowling's rule, Bastard's rule, etc. are used. Based on body weight, Clark's rule is used to calculate pediatric dose. Based on surface area, nomogram method is used for calculation of pediatric dose. The formulas which were mentioned for the above methods are as follows. Young's formula, applicable for 1 to 12 years. Freed's formula, applicable for kids with less than 1 year. Cowling's formula, applicable for kids with greater than or equal to 2 years. Delling's formula, Bastard's formula, Clark's formula, nomogram method. Now, we'll see several case studies which represent the calculation of pediatric dose from adult dose. Case study 1. A 4 kg boy is being treated for elevated body temperature with paracetamol syrup, having a dosing 120 mg for 5 ml. What is the quantity of syrup that is to be administered for the boy? Now you have to consider in this case the general dosing regimen for paracetamol. It is 15 mg per kg per dose every 4 hours. The boy's weight that is given in the question is 4 kg. We'll first calculate what is the amount of paracetamol that is required for this 4 kg boy. Hence, we'll multiply 15 mg into 4. That is equal to 60 mg. Now, our syrup is having a quantity of drug that is 120 mg per 5 ml. Now, what is the quantity of syrup that we have to consider? If we require 60 mg dose of paracetamol, we just have to cross multiply. 60 into 5 by 120, that is 2.5 ml. So, in this case, the child who is having elevated temperature is to be given 2.5 ml of the syrup every 4 hours. Case study number 2. A 6-year baby girl is observed to exhibit flu symptoms. Pediatricians prescribed cefixime suspension. Now, what is the quantity of child dose that is to be given if the adult dose of cefixime is 400 mg? Guess what? How can you calculate this child dose from adult dose? Yes, you can use Young's formula or Cowling's formula. Let's see. The given data is as follows. Baby age is 6 years, adult dose is 400 mg. Now let's first consider Young's formula. Child dose is equal to adult dose into child age by child age plus 12. Let's substitute the given data in the formula. 400 into 6 by 6 plus 12. So when you calculate the same, you get 133.33 mg. It infers that 6-year-old baby girl is to be given a dose of 133.33 mg. Case study number 3. Calculate the dose of vincristine in ml for a 4-year-old kid who is suffering with leukemia. The kid is weighing 37 pounds and is 97 centimeters tall. The dose required is 2 mg per meter square. The drug has 1 mg per ml concentration. Now first what we have to do? Let's convert the pounds into kg. As we all know, 1 kg is equal to 2.2 pounds. Then the weight of the child, 4-year-old kid, is given as 37 pounds. So what shall we do now? We'll quickly convert the pounds into kg. 37 divided by 22, which is equal to 16.8 kg. Now let's calculate the body surface area of the child. For this, we have to take the help of nomograms. According to the nomograms data, we have to use 3600 value for converting a 16.8 kg girl who is having a height of 97 centimeters. So the calculation is follows. 16.8 kg into 97 centimeters divided by 3600, which gives 0.67 meters square. This value is indicating the body surface area of the 4-year-old kid. Now let's calculate the dose that is required for the kid in mg. It is given that the dose required is 2 mg per meter square. Now, what is the dose required for 0.67 meter square? Let's just multiply. So the value is 2 mg per meter square into 0.67 meter square, which is equal to 1.34 mg. Now let's convert finally the dose that is obtained in mg into ml. 1.34 mg divided by 1 mg per ml, which is equal to 1.34 ml. So finally what we could conclude is the 4-year-old girl who is weighing 37 pounds, 97 centimeters tall, is to be given 1.34 ml of the syrup having a concentration of 1 mg per ml solution. So this is how in different cases you have to calculate the pediatric dose from the given data. Finally, we would discuss about the future scope of pediatric dosing. Personalized medicine is the need of the hour for pediatric dose calculations. When we include the concept of pharmacogenetics into pediatric dosing calculations, then we can get a better personalized medicine for each and every child without any compromise of safety and efficacy. Let's hope for the dosing calculations which also include pharmacogenetics in a very near future. Thank you.